Welcome back to Cheddar's Opening Bell, everyone. A concerning number of spikes in coronavirus cases sweeping the nation, and experts say this could just be the beginning.
We are now having 40+ thousand new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around.
Dr. Anthony Fauci weighed in yesterday, and joining us now to discuss is Tom Price, former Secretary of Health and Human Services during the Trump administration. Tom, we're glad that you're joining us this morning. Earlier this morning,
good morning. Good to be
Scott
with you.
Gottlieb, good morning. Scott Gottlieb, former FDA commissioner, saying on another network that we're likely already witnessing hundreds of thousands of cases a day, multiples more than what Dr. Anthony Fauci referenced yesterday. What does the administration need to do to better address this?
Well, I think this points out the fact that this is a new disease and we don't know as much as we'd like to know about it. Second is that there are so many individuals that appear to be being infected, but aren't symptomatic. So they're walking around just like they would normally, and they don't know that they're infected. They don't know that they're able to transmit it, which is why it's so important to make certain that we continue with self-isolation, that we continue with the use of face masks, and that we make certain that vulnerable populations are protected and that we're not doing things that would put them at greater risk.
Okay, so do you think that the Trump administration should come out and federally mandate the use and wearing of face masks?
Well, no, I think public health has always been best run at the local level, at the local or the state level. What's right in certain areas of South Dakota, for example, may not necessarily be what's right for New York City or Atlanta or some other metropolitan area. We're seeing many states mandate face masks. We're seeing many cities mandate face masks, which is not an inappropriate thing to do when they look at their information. But to have it done from the federal level doesn't seem to make a whole lot of sense to me.
Even though Vice President Mike Pence saying less than a week ago that people should be wearing face masks, right?
Well, yeah, don't get me wrong. I think I wear a face mask when I go out and I'm unable to socially distance. I think people ought to. If you believe in the germ theory, which is real, then it's important to wear a face mask when you're out in public. And again, you're not able to socially distance. But there are counties in this nation that haven't had a single case of the disease. Should they be wearing a face mask as well? That's why it's important to appreciate that this is best handled at the local level. Not saying that the federal government doesn't have an important role in guiding folks, in making recommendations, and in making it so that individuals hopefully will utilize those face masks and the socially distancing and continuing of the hand washing and the like.
Tom, the concern, right, for the Trump administration is what we've seen in the polls of late. And we can pull up this full screen here. Recent polling actually from CNBC showing Americans in key swing states, right? Swing states that matter to President Trump, believing the president and people not wearing masks are most to blame for the recent rise in hospitalizations. Joe Biden leading President Trump by 9 percentage points in the average national poll, according to Real Clear Politics. Does the administration need to change its stance because of the polling numbers, even if they don't want to do it from the health perspective?
Well, as a physician, I can tell you that what has always been frustrating is the politicization of medicine and of healthcare. During my time in public life and in public office, I always tried to make certain that health was a bipartisan activity. And so it pains me to see folks utilize health and this crisis that we currently find ourselves in from a political standpoint. That being said, it's incredibly important that the federal government that they do the kinds of things that need to be done to give folks the information that they need so they can best take care of themselves and of their families. And so that, again, states and local communities are best able to make the right decision for their population and their constituents.
As a physician, what's your trajectory, Tom, in terms of where this virus is headed and how much worse it could get?
Well, again, it's a fascinating thing to watch from a scientific standpoint because it is a new infectious disease. And this is the first time in history that we've been able as a society to watch a new infectious disease in real time. So all of the fits and starts that you see, the successes and the failures, all of those things they happen normally in the course of identifying a new infectious disease. It's just that this one is more urgent because of the transmissibility and because of the mortality that we've seen, not just in the United States, but around the world. I think we'll have a vaccine by late fall or first quarter of next year. I think that will be the game changer for folks to get much greater comfort about doing the kinds of things that they would normally do in their lives. I suspect that this is likely going to be an annual disease for a period of time, something that maybe that vaccine is then added to the annual influenza vaccine that most of us take each fall. So, it's going to be fascinating to watch as we continue to see this unfold over the next number of months or years.
And when the vaccine does come out, Tom, would you recommend that people get it?
I told my wife I'd be the first in line. It's incredibly important. Without treatment that is absolutely secure in terms of this new infectious disease, it's incredibly important that we stem the transmission of it and stop the transmission of this disease. The way to do that is by immunity throughout a society. The way to do that prior to their having a treatment that's of the highest quality is through a vaccine.
You know, in the backdrop of all of this, we're learning reports, Tom, over the past few days of a new strain of swine flu out of China. Are you following this, and is it concerning to you?
Again, it's fascinating to watch society as we focus on health and science on a real-time daily basis. This is not necessarily unusual to identify a new type of virus. During my short tenure at HHS, there were a number of different viruses that we were following literally on a daily basis in China. So right now it doesn't concern me, but it bears watching. It's what scientists do all the time, every single day, as they're watching to try to make certain that they're doing all that they can to keep Americans safe. And so we'll continue to follow it, but I don't think that we need to put it on the top of our priority list at this point, given where we are with the current pandemic of SARS-2.
You know, it's really concerning. Tom, tens of millions of people have lost their jobs. Obviously, they've lost health insurance in the wake of that. Continuing claims last week at just under 20 million. Yet they're without health insurance, they're without a job, and they're still at risk of getting this virus. What does the government need to do to protect tens of millions of people who could get this virus without health insurance and without a job?
Well, I think a couple important things to note. One is that both the testing facilities and the federal government have said that everybody ought to be able to get a test regardless of their ability to pay. Second, the remdesivir drug, the one that appears to lessen the severity of the illness and decrease the likelihood of a prolonged hospitalization. Both Gilead and the federal government have said that every single individual needs to be able to have access to that and will. In the bigger picture, I think it's important to appreciate that for folks who lose their jobs, many of them are eligible for COBRA, the health insurance that they had at their job, where most individuals gain their health coverage, and they ought to be able to continue that. Secondly, in terms of the exchanges, it's important, I think, to make more flexible the ability for folks to use the exchanges so that they can sign up as a new individual, having lost their insurance through their job. They've got a window of opportunity to sign up for the exchange, but it ought to be something that suits them, not necessarily what the government thinks they ought to have in terms of health coverage, but what they want. So whether it's direct primary care, whether it's an HRA, whether it's an HSA, whether it's the kind of flexible arrangements so that individuals are able to get the kind of health coverage that they want for themselves and for their family, not that the government forces them to buy.
It is a challenging time, Tom, as we witness this. We got to leave it there. That's Tom Price, former Secretary of Health and Human Services. Thanks for joining us.